The South African Depression and Anxiety Group, that's SADAG, says it has seen an influx of distressed calls from people who are feeling anxious, lonely, worried, depressed, and many more issues since the lockdown started. SADAG conducted an online survey on mental health during part of the COVID-19 lockdown and says within 10 days, 1,200 participants completed the survey. The president of the South African Society of Psychiatrists, Professor Bonga Chiliza, says that he has seen an increase in the number of mental health relapses since the start of the pandemic. This, amongst other issues, because patients are reluctant to leave their homes to collect their medication because of the fear of being infected by coronavirus. Well, we've got Professor Chiliza with us this morning, as well as Cassey, who is from SADAG. Good to have both of you. Thanks so much for participating in this very important conversation.
Good morning. Thanks for having us.
Cassey,
good morning. Thank you for having us.
Thank you, Professor. Cassey, I'm going to start with you. Talk to us about SADAG's observation that more and more people are suffering from anxiety and depression and calling the organization for help during this time.
Thanks, Leanne. And I think, we've been monitoring the number of calls on a daily basis and watching it very closely. And since the beginning of lockdown, a lot of the calls we were receiving were people were stressed, anxious, what's going to happen, what do the rules mean, and just completely overwhelmed by all of happening with the virus and going into lockdown. That was maybe 3 months ago. What we're seeing now is really a progression of people just feeling overwhelmed. They've lost their jobs, the financial impact, the overall anxiety, deeply depressed, loneliness. It's just a combination of really big issues that people are dealing with. We've noticed that our calls have literally doubled since lockdown, and we're seeing them increase on a daily basis. So across the country, people have been affected. Those living with a mental health issue, as well as those that perhaps didn't have a mental health issue before lockdown, but because of the virus and all of the things that have happened, people find themselves even more depressed, more anxious, stressed, overwhelmed, and just really reaching out for help.
Yeah, unbelievable. I mean, calls doubling, that is something that we cannot ignore. I mean, you already, as it is, get so many calls on a daily basis. I mean, Cassey, if I could ask you just for an indication of maybe on a daily basis, how many calls do you get, just so that we can understand?
And I think it's, numbers is important to really see how it's impacting people across the country. So before lockdown, we were getting about 600 calls per day. We're now getting over 1,200, 1,400 calls per day, wow. As well as the number of SMSs that we're receiving have increased. The number of people chatting to us on WhatsApp asking for help has increased. We run a Facebook chat with an expert who go on and answer any questions people have for free. And we're seeing, 5,000 to 15,000 people logging in at any given time. So people are really just reaching out, which again is really great that people are reaching out and they are calling us. So while these numbers look quite scary and that they've doubled and they're increasing on a daily basis, we're knowing that these people are reaching out. It's the people that aren't calling us or don't know about SADAG that worries us.
And that is those are the people that we're trying to reach, perhaps during this interview, to offer them some help. But Professor, I want to come to you now. So what Cassey is saying, you are very much so echoing that sentiment. In fact, you've actually said that the mental health segments of hospitals are getting fuller as a result of people actually relapsing. Perhaps you can elaborate a bit more on this.
Yeah, no, thank you, Leanne. Yeah, as Cassey was saying, I agree with her. So I think what we found in our hospitals, in our psychiatric hospitals and in our psychiatric services across the country, was that during the first lockdown phase, when it was hard lockdown in March, because of all the anxiety around what was happening and the kind of information that everyone was receiving about how deadly this virus was, everyone kind of just stopped and almost froze, from anxiety, and then did not come to see us. And so I think actually SASOB felt there was a need at that stage to put out a statement to say, actually our services are open, please come in, please try and get your medications. Otherwise, we will see an increased number of relapses if you suddenly stop your medication. And this is exactly what we are finding. We're finding that our wards are much, much fuller now. we're finding that obviously in Cape Town and the East and the Western Cape, because of COVID, but also because of this, we're having a really tough time. Our colleagues are really struggling with the numbers, and they're struggling to find beds for all these patients who are suddenly in need of hospitalization.
Yeah, and that's the reality, is that the beds are being used by the COVID patients, and every other illness seems to be taking a backstand, and that's what we really worry for, because we keep on saying that, if you acknowledge your mental health, it is something that you can get help for, and yet at a time like this where they need the help, perhaps help more than ever, they're not being prioritized. Do you find that this is happening?
So we find that what has happened is that there is a sort of a temptation to take away our beds, if you may, from the seniors who are in charge of hospitals, because they just require beds for COVID patients, and so there have been some instances where we felt that the beds in the general hospitals where there are psychiatric wards have kind of, some of the beds have been taken away from psychiatry. We agree that obviously our managers are really stressed and they're looking for beds. And so I think our call is to say, please don't take psychiatric beds away. We already know that mental health does not get an equitable share of the funds for healthcare in our country. So it would be a disaster to have even less money allocated to psychiatry at this time.
Yeah. Cassey, I want to talk to the suicide rate in South Africa. I know it's a very hard conversation to have, but when I was looking at some of the articles referring to suicide and the uptick in suicide, I was looking more at articles speaking to the American situation, and that the suicide rate amongst, firstly, healthcare workers, and these are the reasons given, healthcare workers under the stress of what they are faced with on a daily basis has increased. Those that have been, furloughed or lost their jobs or are bankrupt right now, that's also been an increase in all of that. And people that are not taking their medication because they're scared of getting coronavirus. So those are the three categories of suicides. Are we seeing the same happening here in South Africa?
So while it's really difficult to get any stats with regards to suicide in South Africa, we've just been monitoring from SADAG's perspective on the number of calls and the interventions that we're providing, getting people into hospital, emergency intervention. And we anticipate that this is going to increase as we get further into the COVID pandemic, especially here in South Africa. And it's been incredibly helpful to track what's been happening overseas, to anticipate the increase in mental health issues in South Africa, including suicide. And when we look at the kind of contributing factors that you've just mentioned now, all of those are very real in South Africa. They were here before COVID, and now we've seen even more people who are affected by, they've lost their job. A month ago they had a job, and now they're standing in a queue for a food parcel to feed their family. And these are real issues, and people are really desperate. So we have been seeing more people reaching out who are in absolute crisis and needing intervention. And it has been difficult to make sure that we can get them emergency help. And even you mentioned a really important issue there with regards to our healthcare workers. And again, from the research that we've seen from overseas, it's a huge concern. And that's why, as part of SADAG, as well as other organizations, including SASOP and SASA and SISA and the Medical Association, we launched the Healthcare Workers Care Network to really make sure we look after the mental health of our healthcare workers in South Africa, to make sure that we've got healthcare workers in months to come when we really are fighting the virus even further. South Africa doesn't have enough mental health professionals, enough psychiatric beds, and even enough doctors and nurses to go around. So we have to do whatever we can to look after those frontline workers.
All right, let's, Prof, come to you now as well. Do you see or foresee mental issues going forward from people that perhaps never ever suffered from anything of what we've mentioned here on the program? Do you see an uptick in the cases that may arise from this lockdown? Because it is a difficult situation, and people are finding themselves in a place they've never ever been before. And so this may trigger mental illnesses going forward. Whatever you're dealing with now is one story, but going forward and the ricochet effect of mental illness going on.
Yeah, thanks, Leanne. Definitely. So from the other previous epidemics in the world, there's definitely very clear evidence that there is an uptick in the number of people who then have depression and anxiety following the epidemic. So the so-called second wave, if you may. So there's no doubt in our minds that we are bracing ourselves for a huge increase in people that have not accessed our services. So, for example, the vulnerable people. So, as Cassey mentioned, the healthcare workers. In fact, we're already seeing, my colleagues in the private practice are already actually seeing nurses who are in ICU nurses who have been extremely traumatized, never seen a psychiatrist or psychologist before, and now starting to need psychiatric help. So we definitely believe that this is going to be very traumatic, and many people are going to need our services going forward.
Yeah, and that is the hard reality of all of this. Just a final closing word from you, Cassey. What are the signs? What should you look forward to but look out for if you are watching this interview and you are feeling that something is not right inside of you? What are those feelings that you should be very, very sensitive to when it comes to depression, mental health, anxiety, whatever it may be?
I think, and again with COVID, a lot of these symptoms may overlap, where we're telling people to self-isolate, stay at home. So there could be an overlap, and people often maybe not pick up on the symptoms. And this is where family and friends come in so important, is that they can pick up on these signs and reach out and ask what's going on. So I think just a very low mood every single day, from the moment that you wake up to the time that you go to bed. There's a drastic change in your eating or sleeping habits, feeling tired all the time, wanting to sleep all the time. There's an impact on your daily functioning. So not wanting to get out of bed, not wanting to get dressed or showered or eat. And that can be really difficult. And I think also completely withdrawing, so not connecting, not talking. And that overwhelming fear of just being alone, withdrawing from family, feeling incredibly down and pessimistic. I think it's really important that people know that they can reach out for help, and that all mental health services are still available during COVID. We really want to encourage people that if they are seeking help, to continue seeking their help and their treatment. And for those that are feeling overwhelmed, to reach out for help, either speak to a friend, their doctor, or even at SADAG, is we just really want to make sure that people know that there is help and that there is hope.
Thank you for talking to us, to both of you. Professor Bonga Chiliza, who's from the South African Society of Psychiatrists, and Cassey Chamber from SADAG, talking to us about the increase of mental health issues among South Africans, during the time of COVID-19. Let's take a break. See you after this.